Continuing Mobile Education for Emergency Medical Services Providers. This is Geriatric Psychosocial Issues, Episode 4, Accessing Social Services for Geriatric Patients. By the end of this episode, you should learn strategies to determine when social services evaluation is appropriate, become familiar with the types of services available to older adults, and understand the positive impact a proper social services referral can have.
When people go into their home, I think there's some obvious things that we look at first when people need additional services. Is the older adult confused? Are there clear signs of dementia? They just can't remember. But there's also more subtle things. Are they wearing clean clothes? What does the house look like? Is it clean? Outside and inside of the house being taken care of appropriately. We all look at those things to determine, does this older adult need additional help? We also look at such things as asking questions to older adults. Do you have support systems? Do you have a daughter or son that comes in and helps? Do you have a neighbor that you rely on? Those are the types of places we start when working with older adults to determine a care plan for them and to help them stay in their own home. So we look at those sort of subtle surroundings of the individual and do what we call a geriatric assessment of the situation. And it's really something anybody can do. And once you begin to look at those signs, then you can see we have to go further.
Some indicators that a older adult is in need of social services is often the condition in which they present. Disheveled, confused, inability to ambulate, things like that suggest that they may not be able to take care of themselves in their own home setting. Given that it's the emergency department, I am seeing them very much out of context. I don't see their home environment. I don't see the fact that the fridge is devoid of food, or the garbage hasn't been taken out, or there's dirty clothes around the house, or the animals haven't been taken care of, or all those other things that EMS can identify, which is why that information is vital from the EMS side of things. As an EMS provider, when you're in the house, what should you be looking for? Well, you should be looking for things that suggest that that person is not currently capable of taking care of themselves. For example, the home is very much unkempt, beyond just being not neat, but that there is insufficient food, that, for example, as it gets towards winter, if there is insufficient heat, if there are no accommodations for their illness. For example, someone falls down and injures their hip. There's a concern for a fracture, but their residence is at the top of 2 flights of stairs with no elevator. That's important information to pass on, because what normally we might send home, that is now a flag that maybe this person needs a little bit more assistance to be able to manage in the outpatient setting.
If you go to an older adult's house and you notice maybe a collection of newspapers, or notice that the house is unkept, not just dirty, but stacks of books, stacks of papers, things that you might think could be dangerous. The person doesn't have a way to get in or out of the house safely. Potential fire hazards. Something that might say that the person's not taking care of themselves. No food, no electricity. Those would be indicators that the patient that's coming to Strong would need to be linked up with the social work division once they get here.
Signs that a patient may need social services include an unkept home, insufficient food or heating, an ineffective support system, medical needs that have not been met, and barriers to safely entering, exiting, or being mobile within their home.
I would say that EMS providers have a duty to talk to the social work team when they come to Strong. Let the social workers know of how the environment looked, what was going on, what did they notice inside of the house. Social workers are not able to leave the hospital, so it's really the duty of EMS providers to share that information with the social work team so that we are able to assist that patient, so that we're able to make sure that that patient is well taken care of, that they have all of their basic needs are being met, and so that we can work with them more effectively. If the provider doesn't tell us what's going on inside of the home, we really don't know. And sometimes the patients that we work with aren't able to tell us what's going on inside of their home. They're not able to share with us if their needs are being met. So we really rely on EMS to share that information with us so that we can make a safe discharge plan, so that we can work with a patient or find their family to work with them so that the patient can be safe and well taken care of.
So when EMS personnel is out there, how can they get geriatric patients additional support? There's really two ways to do that. One, Lifespan can provide cards they can just leave behind and ask the older adult, the patient, to call. And we can be out in the next business day out to do a geriatric assessment and link them to services if they did not go to the hospital. There's also something new in New York State called New York Connects. Every single county in New York State has a New York Connects line. That New York Connects is to link older adults to long-term care services and aging services. There is a 800 number in the state, but each county also has their own New York Connects number. For us here at Lifespan, or for us here in Monroe County, it is Lifespan. So someone can call 24 hours a day, 7 days a week, to our phone number, get a live body, and we can send someone out the next business day. But it also can help, even if an EMS person just gave the name and phone number of the individual, we can call them the next business day and arrange a meeting. But sometimes just leaving a pamphlet behind, someone will call us to get services and help to them. If an older adult has been brought to the emergency room, we work all the time with discharge planners from the emergency rooms to help that older adult once they go home. So that is the way that we can help in that situation.
I would say Rochester is quite unique in that we have a lot of services that are available. One thing I try to do as an ED social worker is to make sure that older adults have the services they need to be successful in their home. We have a great website that we use in the ED. If you were to Google Grape Services of Rochester, you will pull up this website with tons of different services such as cleaning, cooking, nursing care. If you need someone to repair your home, this organization has put together a ton of different resources so that with the goal of making sure that the older adult is in their home, they have the services that they need, and that they can stay there as long as they need to. Now, there are some older adults that we might think, well, you know, we're not so sure that it's time for them to go into the nursing home. Physical therapy will see them and will say, well, they don't really meet nursing home criteria, but we're not so sure how they're doing in their home. So one agency we tend to refer people to is Adult Protection Services, or what we call APS. And APS will go out to the home and kind of assess the situation and figure out what does this person need to be successful and safe in their home. And if they're not safe in their home, they'll try to come up with resources to provide them so that they are safe and they can have their needs met.
To access social resources, talk with an ED physician or social worker, contact those resources directly, call Lifespan, view the Greater Rochester Area Partnership for the Elderly website, or go to nyconnects.org. After viewing this episode, you should know strategies to determine when social services evaluation is appropriate, become familiar with the types of services available to older adults, and understand the positive impact a proper social services referral can have.